Health Minister Rona Ambrose may very well be asking what the heck is Health Canada on. The governmental department authorized doctors to prescribe heroin for certain patients who have failed to respond to conventional treatments. But within moments of that decision, Rona Ambrose slammed it. Marissa Semke is tracking this story for us today. She joins us now live from our Toronto newsroom. And what are we hearing in regard to this decision? Very bizarre.
Yes, it is bizarre indeed, Alex. What we've seen is government bureaucrats, many are saying, have used a loophole to allow certain individuals to legally receive prescription heroin. This decision was made under a special access program, which is a program for doctors to have access to drugs that are not otherwise available in Canada for sale. These drugs are allowed to be used in special circumstances when a patient is faced with life-threatening conditions and other conventional therapies have failed, Alex. Now, Health Minister Rona Ambrose rebuked this decision moments after it was released. Here's what she said. This decision is in direct opposition to the government's anti-drug policy and violates the spirit and intent of the Special Access Program. I'm taking immediate action to protect the integrity of the Special Access Program and ensure this does not happen again. Now, these 16 individuals were part of a larger experiment testing a new drug to wean off addicts off of heroin. Now, doctors were concerned, of course, about the lack of exit strategy for certain addicts, and as a result, for those addicts, of course, that were given heroin during this experiment, and therefore requested that these 16 individuals be allowed access to heroin after the experiment finished. Now, many are wondering why the doctors, and at least in this case, chose to maintain the individual's addiction rather than try to cure it, Alex. And of course, I spoke with a former heroin addict. His name is Jim O'Rourke. He is the head of a society that helps to cure certain addicts of heroin, and he thinks that this decision would only perpetuate the problem. Let's take a listen to what he had to say.
Their idea is that addicts relapse because of trauma, and the best way to keep them away from trauma is to keep them medicated. Rather than dealing with the trauma, right, and getting ahead and getting a life, we're just going to give them free heroin.
Now, supporters of this ruling are saying that this will create stability in some of these patients if monitored under a medical environment. But of course, it's certainly a contentious debate, and there are a lot of people that are upset about this, especially because it would be taxpayers' money that would be funding this heroin, Alex.
Interesting story. Marissa Semke reporting. Thank you for this.
Thank you.